Hi, everyone. Welcome to our June Lunch and Learn session. We have more than 200 registrants that will be joining in the next several minutes, but I can go ahead and get started with just an introduction to Text Protects. And then we will have a wonderful conversation with an amazing panel of leaders today. So Text Protects, if you are not familiar with our work, we are the only nonpartisan policy-based nonprofit organization in the state of Texas focused on child abuse prevention and intervention. And our work certainly is in the space of policy and moving, advancing legislation, but also in ensuring that programs are able to scale across the state. Today, we're talking about racial equity, and I say this every time, but I'm going to say it again. We are so fortunate to have these stunning leaders on the call with us today. And so today we have with us Brittany Taylor Ross, Tanya Rollins, Dr. Cynthia Osborne, and Dr. Teresa Granillo. And I could read their bios for the entire hour. These women are extraordinary, but instead of doing that, I'm going to ask each of you to share the organization you're with, if you're with one, your title, and we love to start off each of these sessions with what draws you into this work. And let's start with Tanya.
Good afternoon, everyone. Thank you so much for having me. I am currently a PhD student at the University of Houston Graduate School of Social Work, and I am sole proprietor of Inspiring Voices Equity and Inclusion Consulting, LLC. My former role was as a child welfare professional in DFPS. I spent 30 years working in DFPS before my retirement last year in several different roles. I started out as an investigator, but I ended as the disproportionality manager, looking at equity within the child welfare system. What draws me? So I tell people what brought me into child welfare, it wasn't this honorable thing, right? It was a job at a time when I needed a job right out of college. So I talk more about what kept me. What kept me in child welfare and what keeps me in child welfare, because I still consider myself part of the child welfare system. I'm just not an agency employee anymore. Is this desire for equity, this desire for our families to be honored in their humanity and their dignity. That's what keeps me here. I'll pass it on to Dr. Granillo.
Good afternoon, everyone. Really thrilled to be here in the company of like Jess said, these fabulous leaders and all of you who are in the audience. I am Teresa Granillo, the CEO of Avance, an early childhood organization that focuses on more so on the parenting side of the work, but also we specialize in serving particularly Latino families living in low-income communities. What draws me to this work is many reasons, but most importantly is it's the perfect intersection of my personal and professional experiences. So I'm a Latina who was raised in a low-income single-parent household, so I can relate to the families that we serve. We use social services, we moved around a lot, and my mom used to tell me that if I didn't want this life, that I needed to get an education. And as a good Latina, I listened to my mama, and with a lot of support from my family and mentors and teachers, I pursued a master's in social work with a special focus in working with children, young children and their families, particularly because of the experience I had and the way that they influenced my life. So 2Gen has always been a focus of my career because a child does not exist without the family, and we can't distinguish the two. And then I went on to earn a PhD in social work and psychology, and now I use my education and lived experience to support children and families, not only to navigate the inequitable and racist systems that they face every day. But my hope is that together we can dismantle those systems and then rebuild them with equity centered so that we no longer need organizations like Avance. Our goal is to solve the problem, not serve the problem. And that's what keeps me here.
Dr. Osborne, would you like
Sure,
to go
I'll
next?
go next. Well, good afternoon, everyone. I'm Cynthia Osborne. I'm a professor at Vanderbilt University, as well as the director of the Prenatal to 3 Policy Impact Center. And what brings me to this work, I'm a former teacher. I got into teaching because I was pretty sure that that was the answer to how it is that kids can succeed in life. I grew up in a very working class family, and my schooling was really the thing that made it so that I could go on to college and kind of get ahead from where I started. But it was when I became a teacher that I really understood that there's so much more going on in our families' lives than what they're just seeing in school, within their community and within just their social networks. And I was really committed to figuring out how our policies and our communities can actually better support families. When I taught in an area that was nearly all free and reduced lunch and nearly all Latino families. And I just learned that my experience growing up, even though I came from a very modest family background, was so different because of my privilege of being white. And so I really wanted to center the work that I do to figure out how we can create greater equity, how it is that our policies can support that as well. So to dismantle the system, as Teresa said. So thank you for having me today.
Good afternoon, everyone. My name is Brittany Taylor Ross, and I am the Prenatal to 3 Policy Manager at Text Protect. So I work alongside the wonderful Jess every day. And very similar actually to the other wonderful leaders on this call, I was a social worker in a former life. And my first job out of school was as a child welfare worker here in Texas. And I think, just spending time with families on the ground and, just really opened my eyes to the importance of inclusive policymaking and how destructive policymaking can be when it's not viewed through a racial equity lens. So that really ignited my passion for trying to impact change at a higher level. I'm really excited to be here with you all today, and I'll pass it back to Jess.
Thanks to all of you. I was reflecting as you were sharing your whys, and for me, I have commonality with many of the comments that you shared. For me, my why is Dr. Granillo also lived experience and exposure to trauma early in my life, combined with public health education, where I really came to understand the disparities that exist, but also the solutions on how we can ensure that every child and every family can be set up to thrive. So thank you so much. Before we jump into our first question, I also wanted to thank Children's Medical Center of Dallas that just came in as a sponsor of our Lunch and Learn series. So we're so very grateful for their support so that we can share out all of this wonderful information across the state. And so, Dr. Granillo, I'd like to start with you first, and was wondering if you could share your perspectives on racial equity as you think of community work.
Yeah, absolutely. Well, I can't speak on behalf of everyone, but I'll speak on behalf of Avance and the work that we do in the community and how we center equity in our work. And so first and foremost, a part of our value in our practice is to embrace the power of proximity. We know that those who are best suited to serve the community and solve the issues that the community is facing are those who are from that community. And this is why 46% of our staff are alumni of our program, whether that be they went through Head Start, they went through our core parent-child education program, or they were family childcare providers. And we absolutely honor that. And I just want to make a comment about that it's not just about your programmatic staff. So our leadership team includes 6 people, all of whom are BIPOC, majority of whom are Latina, and all of whom who share the lived experiences of the communities that we serve. And in fact, one is a parent alum. So she went through the parent-child education program, worked in the Dallas chapter for 15 years, and now is at National as a senior director. And so we really do, value and recognize the power of the voice and the lived experience and the perspectives of those from the community. And these are intentional, right? You have to make sure that this work is intentional to make these decisions, because without their voices and the experiences and perspectives of our families, we can't, and the community that we serve, we cannot effectively drive decision-making that's going to meet their needs. And so that has to be an intentional practice. We also center equity in our programming. So it's important that we ensure access to all individuals to our programming. And so we do this in many ways. One is we ensure that everyone who we serve has access to our programming in their native and preferred language. So for our parent-child education program, most of our families and children that we serve are Spanish speaking. So all of our staff are bilingual. Materials are available in English and Spanish. For the family childcare providers that we work with, many of them speak Vietnamese and Farsi and many other languages. So we have business coaches on staff who actually speak that language. They're getting their coaching in their native and preferred language. And again, those are intentional decisions to meet our families and our providers and the community that we serve where they're at. The other thing that I'll mention in terms of programmatically making intentional decisions to center equity, we know that the families that we serve, much like the staff that we have, and this speaks to what you were saying, Jess, have experienced a plethora of trauma throughout their lifetime. And so we recently revised our curriculum to include an entire unit on family well-being. We talked to our parents about toxic stress and ACEs, adverse childhood experiences. We have discussions about how trauma from their childhood could influence their children and their child's brain development. We teach them de-stressing activities that are culturally responsive and culturally appropriate. And by delivering our program in a cohort model, parents get the opportunity to create community. We create a safe and brave space for them to come in and to meet other parents and individuals who are going through similar situations so that they don't continue to feel isolated and alone, and they can share their experiences in a non-judgmental space. So for many of our parents prior to coming to Avance, they say they felt isolated and scared and didn't have a space to share those struggles. And so one of the ways that we create that space is by having proximate staff. Many of our staff are those who have been in their shoes. They were once parents looking for support and resources. And so there's that connection and trust that's built. And that really is the foundation, I think, of the work that we do in supporting these parents. And then the final point that I'll make, because I know we're limited on time, I could go on forever, is just about the importance of meeting families and staff where they are. So this is a critical value at Avance. And one of the ways that we do this is really ensuring that we take a strengths-based approach and recognize the funds of knowledge that our parents, providers, and staff come with. And at Avance, we literally meet people where they are, meaning we go door to door. That's our recruitment model. But we also meet them where they are in their life journey. So we capitalize on parents' inner strengths and their innate love for their children. And then we walk alongside them. I think we sometimes in this field, we often use the terminology like, we're here to help. At Avante, we're here to walk alongside you in your journey as you develop the goals that you want to reach. And then we help you access the skills and the resources that you need to become the best teachers and stewards of your children's growth and success. So I'll stop there.
Thank you. There's so much that you said that really resonates with me. One, as a leader myself, is understanding how important intentionality is. And I often say this in working with collaboratives, that there is a necessity to really make sure that equity is part of every discussion we're having over all of the work, in particular until it becomes muscle memory. And so that really spoke to me. I think it's critical, particularly for organizations that are at the early part of this journey. Another thing, when you were talking about your staff, I may say this every Lunch and Learn series, so just bear with me, everyone. But I say all the time that our staff are humans first and employees second. And I feel like we have multi-sector practitioners, we have multi-sector leaders on this call. I feel like that is so important for all of us to remember. And then the strengths-based approach. I think community members, whether working with a community or if we're working with a family, everyone knows what the problems are. And there is a point where when we're coming in as practitioners or leaders, that if we focus on the inherent problems, it feels like a beat down because everyone already knows what the problems are. But it's so encouraging and healing to focus on the strengths, and to place our focus on building strengths rather than honing into what the problems are. So thank you so much. And we're going to have time. I want to make sure everyone knows if you have questions, please put them in the Q&A function or in the chat function. We'll be monitoring both. We will have time at the end for questions, but I'll also try to monitor those in between. And so now, Tanya, you are so humble in your introduction. You have held so many roles and leadership roles at DFPS, and your service has been tremendous. I was wondering if you could share with us during your tenure at DFPS what you found to be effective in addressing structural inequities and also where the opportunities continue to lie.
Thank you. So I wanted to start. Dr. Vanilla kept using that word intentionality, and that's the word I want everybody to write down, right? This doesn't happen unless you're intentional. And unfortunately, a lot of times, somehow we think that just by hiring a diverse group of people, right? This phone call is diverse, or this webinar, that somehow stuff magically happens. And it doesn't magically happen. You have to be strategic and intentional. And luckily for me, and I say lucky because I've been blessed to be able to do this work. In 2005, when Joyce James and the legislature started doing this work, it was intentional, right? And they laid the foundation and the framework for what we know works, right? And I like to say it's not rocket science. We know it works. It takes motivation, strategy, and being intentional about it. We know that looking at your data, right? From the, at every level, looking at your data, at every decision point, looking at your data, right? But disaggregating your data by race and ethnicity. So I have to make sure that is clear. A lot of organizations will say, well, I pulled my data and this is the overall framework. That doesn't tell you what families are benefiting and which families aren't benefiting, right? We know that when we look at data, according to a study which has been posted for you, a lifetime prevalence study, 53% of Black children will be touched by the child welfare system by the time they turn 18. It is 28% for Hispanic children and 24% for white children. We know that children of color are going to be touched by this system. We know that because people are being intentional about using data. We know what the disparities are in child welfare because we're intentional about pulling that data, right? Now, and by the way, when I say child welfare, everybody on this call is part of the child welfare system. Now, the difference is whether you're part of the agency, a provider, a researcher, a mandatory reporter, policymaker, we're all part of the system. The other piece is community involvement. Actually having community involved in decisions, hiring decisions, policy decisions, implementation decisions, support systems. We know that works. And I glanced at the chat and saw that Kathleen Lavelle out of Dallas is on here. She's a community person who's been doing race equity work on the ground related to child welfare, right? Making sure, I often brag that I am the only position that I know, or my old position was the only position that had community at the table, right? So when I was hired, I had to sit in an executive conference room with 12 community members and the commissioner of DFPS at the time. What that told me was I never forgot who I was accountable to. I never forgot that I was accountable to community, right? There's also the piece that community can say stuff that DFPS isn't going to be able to say. I also want to say cross-systems collaboration, right? Calls like this, policy work, and understanding that Text Protects and other organizations, you have the ability to do things that the agency isn't able to do, right? And then leading through anti-racist principles, keeping it at the forefront. And I like what you said, Jess, it has to be in every decision. Dedicated FTEs are great, but you need to have people that are willing to speak up, even if that dedicated FTE isn't in the space. You have to develop a culture in which that discussion is going to be had, whether that dedicated FTE is in the room or not. My colleagues used to joke that I would be in a meeting and somebody would say race or racism, and everybody's head would go like this. Like they would immediately turn to me because I was the dedicated FTE. That shouldn't be the case. That should never be the case. And the discussion needs to be normalized all the time, right? And so I know we're short on time, so I'm going to talk about what needs to happen. What needs to happen is it needs to be part of DFPS's strategic plan, right? It needs not to be this thing back here that, yeah, we're doing it, but we're not going to be explicit about it. If you're going to put in writing that equity is one of your guiding principles, right? That equality is part of your vision, then you have to do that, right? And so what that means is you can't have policies that discriminate against LGBTQ plus children. You can't do that. You have to make sure that programs like Knowing Who You Are, racial and ethnic identity, are still required for every person in CPI, CPS, and prevention. Why? Because everyone would be confused, highly confused, if we thought that over 10,000 employees were coming to the table with the ability and the knowledge about families of all different races, ethnicities, all different cultures, and all different socioeconomic backgrounds. So you have to be willing to step out there, right? You also have to be willing to understand, right, that policy. You have to put the policy and the legislation in place. Dr. Jessica Price out of Florida talks about change must be legislated. That piece is true, right? The other piece is transparency. Communities want transparency, right? I consider myself on the other end. I want transparency. If you tell me that removals are down, tell me why they're down. What exactly have you done? What is the impact to all of these communities that we serve, right? These are the things that have to be improved on. What's your goal? What's coming next, right? And then the last thing I'm going to say, we have to understand there's a difference between prevention and reaction. Any program that takes place after a family has contact with Child Protective Services is reaction. Avance is prevention, right? Legislation is prevention. Policy can be prevention. But once CPI has contact with the family, it's reactionary. And we know that those reactions do not fare well for Black, Brown, and Indigenous persons. And we need to work on every aspect of the system.
Thank you, Tanya. You know, I mentioned that at my core, I'm a public health practitioner. That will always be the case, no matter what role I have. And so I love your emphasis on primary prevention and ensuring that families have everything that they need. I also really, when you were talking about all of the stakeholders, we are all a part of the child welfare system. And the other stakeholders that you didn't mention, but I think of private funders, I think of local government. This problem is so tremendous when we look at the number of children that have experienced some form of trauma, whether racial trauma or abuse and neglect. It's 1 in 3 children. And so it really will take all sectors to come together to be intentional about racial equity and children's well-being and to move forward together. So thank you so much for what you shared. Dr. Osborne, you are embarking upon, I guess I want to say new research, but really it's exploration into, into what you have studied in the past when it comes to prenatal to 3 children and families. And so I was wondering if you could talk to us about this new direction and what got you to this point.
Well, I'm happy to, and it's always just so inspiring to hear both Teresa and Tanya to speak. So I appreciate all that you guys have shared so far. So what we do at the Prenatal 3 Policy Impact Center is strive to identify what the most effective policies are that create an equitable and strong start for all of our children. That the science of the developing child is so clear about how important these earliest years are. And that, as Tanya said, it's not rocket science about what it is that children need either, but it is brain science. That we know that stimulating environments, nurturing environments that have limited exposure to adversity make a huge difference, not just in the short term, but across the lifespan. But the question is, so how do we create that? And why is it that disproportionately it's children of color who do not have access to the environments that they have this right to, children from lower socioeconomic statuses? And how can policies intervene to rectify this? And so for the past 3 years, we have turned to whatever the research says about what is effective at creating these conditions. But we wanted to push a lot further to really understand not just what creates these conditions across the board, but what reduces these disparities and ensures that every child is off to a healthy start. And I will say that the research is not as clear as it needs to be, and that this isn't a webinar on the problems with research, but I could talk about that all day. But there are a lot of gaps that sometimes, we study what gets funded. We study what is actually being done and with large samples and so forth. And there's so much that we haven't learned about what works for whom, under what conditions, and how the implementation really drives what is better serving families. And there's so much that we've left out of really understanding the lived experience of families, so that we're not just looking at the data or the numbers, which is important, but we're really understanding the story behind that, and that it's coming from the community. So that's what we're striving to do for all of these policies that we have identified that are quote unquote effective, but to really understand whether they're equitable. One of my colleagues, Ioma Ruka, made a statement early on when we started this work. She said, well, how could something be effective if it's not also equitable? And I thought, well, that's it. That's what we have to strive to do. Now, what we've found so far, which I think is important, is that the policies that are the most effective and have the largest impact on reducing disparities are our economic and family support policies. That the ones that reduce incidents of child neglect are also the ones that are reducing disparities in a host of outcomes, including birth outcomes and access to services and so forth. And so those are things like expanding Medicaid, having a minimum wage that's at least $10 an hour, earned income tax credits that put money back into families' pockets, so to speak. Now, accompanied by targeted interventions, which are so important, and the more that they can be culturally responsive, are even more effective. But what we want to do is not to just look at what the data say when we disaggregate it by race, ethnicity. We want also to really understand the theory of change. Too often, so I'm old, and when I was taught how to do methods in school, I'm a demographer. Well, you control for race, you control for gender, you control for age. But we can't just control for race, because race isn't what drives these disparities, it's racism. And so we need a theory of change of why and how racism and structural racism will lead to differential impacts for our policies. So again, I want to hear more from the folks who are doing this closer to the ground, but what we want to do is to provide states who are ready with the answer of how can I create policies that are anti-racist and that will ensure that all children get off to this healthy start and thrive.
Thank you so much. While you were speaking, we had our first question come in. And so Brittany, we will make sure and leave time at the end so that Brittany and I can share with you the policies that are on our agenda going into the 88th for Tex Protects, and how to connect with us in order to advocate and support that agenda. But the question that came in, and I'll pose this to all of you, in regards to strategic planning and being intentional with programs, what are some policies from the legislative end that are already set in place that are making a difference? How can we use the data to drive change that we want to see in our communities? So I think if I'm understanding the question right, it's both policies and practices at the program level, effective legislative policies, and how can those be married to be able to see change? Yes, ma'am, good. I'm getting it right. So how those could be married so that we can see sustainable change in our communities. And I'll just open it up to whoever feels comfortable starting to.
I'm going to let Tanya and Dr. Osborne talk about the policy side, legislative side. I will say in terms of strategic planning and like best practices for centering equity, Tanya mentioned this earlier, and it's something that, is inherent in our model, but it's intentional. We've made sure that this is a practice of when you're doing strategic planning, that it's not just the leaders of the organization in the silo making decisions, that it has to have community representation, and particularly the community in which you serve has to be at the table alongside, other key stakeholders, with a voice in making those decisions and driving the strategic plan forward.
I think, that's a very interesting question, because you asked what is making a difference, right? I can tell you what made a difference and what was reversed, right? And that what needs to go back. Because in Texas, we're at a point where a lot of the things that were put in place have been reversed. So one, when we had the Center for the Elimination of Disproportionality and Disparities at HHSC, which was focused on looking at things across disciplines, across HHSC. And then it was defunded. And so it went away in 2018, right? We know that actual legislative funding for organizations or centers that actually do the work, we know it works, right? We know that when the legislature actually said you will provide dedicated FTEs to doing this work, it worked, right? And then it went away. We do know that we have legislation on poverty that says, it's very clear. We should not be validating families for abuse or neglect when it's poverty related. But then you have an implementation, and child welfare across this country conflates poverty and neglect, right? Which is problematic. Senator Royce West last session had a bill that would have required every state agency to do an equity assessment on a bill when they were analyzing it. That works. It's been done in other states, right? So I think there are things that could definitely be beneficial. Funding child welfare. There have been bills that would mandate CPS or DFPS actually do detailed research into disproportionality, which would integrate what Dr. Osborne is talking about. But it was an unfunded mandate. And an unfunded mandate is like a pointless mandate when you're starting to talk about government, right? I think really promoting, and I'll let Dr. Osborne go into this, the safety nets. We know from COVID that safety nets work. When you took our families away from the eyes of mandated reporters, and they had the safety nets, the community supports, our numbers went down, right? But more importantly, families didn't have to have the contact with CPS. And the American Public Health Medical Association actually said emergency room visits for serious child abuse did not increase. And so that should say a whole lot about what happens when we do with Dr. Osborne. And I'll turn it over to Dr. Osborne.
No,
And
I mean,
before-
in the interest of time, I will just say that what Tanya has said is exactly right. And to just make sure that we understand that we do make a difference with every policy choice that we make. It can make a difference for the positive, or it can make a difference to actually exacerbate inequality or to make it more difficult for families. And so within our state, we really have to be clear about which direction we want to go, because all of our policies make a difference.
Thank you all. Tanya, I'm so glad you brought up the need for the office to be reinstated. We did carry that as an agenda item on the Texas Prenatal to Three Collaborative, of which Tex Protects is a lead organization during last session, and we're doing so again this session, and absolutely agree with you that it's critical. So with all of this really rich information and perspective, Brittany is our extraordinary prenatal to three policy manager and a part of the policy team at Tex Protects. And Brittany, I was wondering if you could share some of the policies just at a very high level basis that we are looking at going into the 88 that both strengthen families, but also very critically strengthen communities.
Definitely. Thank you, Jess. And I just want to say I am so grateful to be a part of this conversation. I was taking notes the whole time all of you were talking. I feel like I've already learned so much. So just very appreciative to be in your presence today. So I'll talk a little bit about how Tex Protects as an organization is already gearing up for the 88th Texas legislative session, which will begin in January of next year. So as an organization, we will be working to analyze all of our policy proposals through a racial equity lens. We're going to be focusing on several primary prevention approaches, including universal nurse home visitation, increasing access to resource and referral systems for families, and of course, preventing adverse childhood experiences. Our focus is going to be on supporting families, hopefully before a crisis occurs, in order to limit unnecessary contact with the child welfare system. I really love, Tanya, what you said about focusing on how can we focus on prevention and not just being reactive. Love that, wrote it down. That's gonna be one of my new mottos moving into next legislative session. So universal nurse home visitation is just one proven strategy that we'll be focusing on this next session, because we want to ensure that, again, we're meeting families' needs before a crisis occurs. Universal nurse home visitation has a short intervention period, and these programs are meant to connect families to the resources and referrals that are already in their communities at the right time. And most importantly, these programs have been proven to keep new moms and babies safer and healthier. Texas already accounts for about 1/10 of the babies born in the United States. And, unfortunately, the outcomes in Texas for moms and babies definitely leave room for some improvement. We know that maternal deaths and pregnancy complications remain a significant concern in Texas, with Black women bearing the greatest risk of death or severe pregnancy complications. The 2022 Texas Maternal Mortality and Morbidity Review Committee report, such a mouthful, but that really great report recommends community home visitation programs as just one strategy to help combat maternal mortality and morbidity. Moving on to the importance of preventing adverse childhood experiences, and again, these are also called ACEs, and they are potentially traumatic events that occur in childhood, including abuse, family violence, neglect, and the death of a parent or guardian. We know that ACEs disrupt neurodevelopment and increase the likelihood of negative health, behavioral, educational, and economic outcomes. Our data suggests that about 1/5 of Texas children, which is about 1.4 million, have experienced 2 or more ACEs before their 18th birthday. So we know that preventing ACEs can reduce healthcare costs, improve economic productivity, reduce crime, and also boost educational achievement. We really believe that Texas needs to view ACEs as a multi-systemic public health issue. When children and youth experience serious adversity, we feel that we really have a shared responsibility to help buffer that impact. Prevention strategies like we're talking about today can really help to reduce the prevalence and impact of ACEs, while also increasing a child's opportunity for cognitive and emotional development and just overall well-being. And as Jess touched on earlier, Tex Protects is one of the 3 lead organizations for the Texas Prenatal to Three Collaborative. And we have been working over the past several months to put together a diverse group of parents from across the state of Texas to lead what we're calling the Parent Advisory Committee. And this council gives parents with lived experience the opportunity to give policy feedback. And we're really excited to start to work with this group, really amazing group of caregivers on our policy proposals and to really lift up the community voice aspect of the work that we're doing. And finally, just to round it out, in partnership with the other two lead organizations that are a part of the Prenatal to 3 Collaborative, we of course are working to lift up and support their really great policy efforts moving forward. So that's Texans Care for Children and Children at Risk. So we'll be working during the legislative session to support their policy proposals, which they are doing a ton of great work, but just two that I wanted to highlight: ensuring healthcare access for new moms, ensuring continuous coverage for children, healthcare coverage, and of course, ensuring that all children have equitable access to high quality childcare. So we'll continue to lift up those policy proposals. And I will send it back to Jeff.
Thank you so much, Brittany. I wanted to mention that in addition to the ACEs research and framework that is focused on individuals, we also hold highly the research that is associated with adverse community experiences. And so any legislation that Text Protects would work to advance will also address what we've been talking about on this call, which are the root issues of family instability, of child abuse and neglect. And that goes to all of the community adversities that ultimately are preventable as well. There are a couple questions that came up, and so I'm gonna work my way through them, and again, just pose to the whole group. I will say a couple of these are on universal strategies and resource and referral networks, and we're actually going to have a whole webinar session on universal strategies, in particular highlighting universal nurse home visitation and Text Protect's vision that there will come a day when every mother will be offered nurse home visitation after giving birth to their child, and also the Help Me Grow network. So that is to come, but we can answer some of these questions briefly today. So everyone, the first question, so accessibility seems to be the challenge, absolutely, always. Parents who are not involved in the system are aware they need help. What are the innovative efforts to make access to support more of a consumer-friendly option? And so I'm wondering if one of you would like to talk about closed loop referral systems such as Help Me Grow and our work to ensure that there isn't a prescriptive framework. And so every community can set those up the way that makes sense to them, but there's adequate data sharing with the state, whoever would feel comfortable.
I feel like you've kind of answered it in providing that resource and understanding the importance of these coalitions of service providers, that what Tanya said, cross-sector, right, collaboration, where you're communicating with one another and then making sure that you're following through with the data to make sure that the parents and the families have received all the resources that they need, and that somebody's following up with them. I do just want to say, in response to the question about, like, I think there was a comment in there about parents who are not in the system or not aware or are aware they need help. I think that there's a huge benefit here, and it goes back to what Tanya says about prevention work and what Avance does. And it is the power of education. And I'm not talking about a college degree. I'm not talking about a high school degree. I'm talking about knowledge in your hand to know, oh my goodness, I, as an adult and now a parent holding a 2-month-old, have just been gone through a presentation of ACEs, and now I'm recognizing that I myself went through a lot of that, and then having a conversation about what were your parents like, what's the kind of parent that you want to be, and then how do we create a roadmap for you to be that parent that you want to be, but having some kind of the earliest conversations, the earliest education about these different experiences with trauma that can impact your own parenting and impact your child and their development is absolutely critical. And so we do need to think about ways to get this information into the hands of parents as soon as possible. One of our parents that has participated in Avance told us that we should create videos of snippets of information that women who are in the hospital to give labor are watching while they're waiting. And I was like, and that came from a parent. I'm like, that is so brilliant. So yeah, we need some funding for that, right? But it's about getting that education and getting it into the hands, meeting them where they're at in the moment they're about to have a child and they're thinking all these things and oh, there's information that I can now process to help me right when that child is born.
And I would also add that there's a movement for warm lines, right? Or more warm lines, helplines versus the agency's hotline, right? Because right now, as it stands, if a parent is calling the hotline thinking, I just want help, the result is a CPS report, right? Depending on what they say. Versus a warm line, which would actually give parents the ability to call somewhere and say, look, I just have this question, or this is what I'm going to, where do I seek help, right? And so in us changing this philosophy of mandated reporting to mandated supporting, right? And warm lines actually do that. And that also means working with our mandatory reporters about when does someone need a CPS referral? And when does somebody just need help? When do they need concrete services? They don't go hand in hand. And right now, our mandated reporters, honestly, they have a CYA approach to reporting, which, we're on the line, so I'm not gonna tell you what CYA means if you don't know, but it's about let's do what's best for families. And if a majority of our cases are neglect cases and a majority of those cases are ruled out, that tells you families need help, not a report.
Need help now more than ever, particularly coming out of the pandemic and just having faced, if we look just at the last 2 months for all of us, all of the things that our families are facing. Another thing I wanted to offer to everyone is that warm lines, and I think of Help Me Grow's really beautiful framework being implemented in several communities across the state. It also provides, we talked about data at the beginning of this call, it provides a really robust data repository of here are the needs of families, and here are all the services where we have enough resources and we have enough organizations providing these services, and here's the big gap. And then that allows communities and funders to come together and really solve for, if we're going to serve the needs of families, then we need to make some serious investments.
Jess, I just wanted to add that you've been talking about the universal home visits or the Family Connects model and how that differs a little bit from Help Me Grow and why both are needed. Warm lines, I love that definition, Tanya. I hadn't heard that used before, but it still requires someone to reach out and ask, to call 211, to call any sort of line. And there's a lot of families who won't know to do that, wouldn't know that they could do that, would be afraid to do that. And the reason why the voluntary universal programs can be so helpful is that everyone is asked with the idea that we all need help. In the Family Connects model, it demonstrates that something like 96% of all families need something, and this is all families are offered this. This is not income specific or anything, and so it's reaching out and asking for help normative, not stigmatizing. And it is, childcare providers can do this, Avance does this. It's what we as community members need to do, is to say, we are centering you and we are here with resources if and when you need them. And so expecting that folks are going to call us might put the bar a little high for some of those who really need our help.
And I just want to add one more thing, and it's a story from one of our, who's a now staff member at one of our chapters. But when she was a parent, and her sister, she had just had her first child. Her and her husband were living with his family. He had just lost his job. Lots of things were going on, and she was feeling very isolated, even in a home full of other family members, because she had this infant and didn't know what to do. Her sister was working for Avance. Her very sister said, "You should go to Avance." And this, I won't reveal her name, but she was like, "I don't need a program to help me be a," it was a very knee-jerk reaction of that because of the approach. You should go to Avance, right? But the education that there's something out there, should I need it. 3 months later, she called, enrolled, her children, her son is now a lawyer. She is now the director of programs. Like it transformed the life. But it was that idea that they may not need it right now, or they may not take it right now, but if you're offering it out, they at least know it's there.
Thank you so much for sharing that story. I love that. I mean, it's a great example of meet individuals, meet families, meet systems and communities where they are, but with a focus on change and transformation. This happens every time. I feel like we could continue this conversation for 3 more hours, and we can't. So we have 3 minutes left. I just wanted to highlight a couple of things. First, I wish everyone could join me and we could give a standing ovation for this amazing panel. I want to thank each of you so much for being here. I also just want to thank you for the spirit that you bring to leadership in this area. I feel incredibly inspired after talking with all of you. I wrote down a number of resources. So there was also a question about resources for parents. We will send out the recording of this session. And with that, we will send out resources for parents, racial equity resources for organizations. Should your organization want information on an organizational assessment or different consultants and partners that you can work with. We will also send out additional information on Dr. Osborne's research and policy work. And I'll just pitch this for you, Dr. Granillo. She mentioned a need for funding. So for our funders on the call Dr. Granillo. And I want to just encourage you, we are on the heels of the 88th session. We need all of you. We need all of our partners and advocates across the state, Text Protects. And so you can go to textprotects.org. We actually have a new website launching in about 2 weeks, and we'll have even more resources and ways that you can connect with us, but you can sign up to receive our action and advocacy alerts. And we know it's going to be an interesting session already. And so if you will take the time today, it just takes a minute to sign up for our advocacy alerts, then we can keep you posted and engage you both before and during session. The last thing I will say, I say this every time, this is a hard time for all of us doing this work. It is a hard time if you're a practitioner, a parent, or a leader. And so please do what you need to do to take care of yourself during this time. And we're so grateful that you took the time to be with us. Thank you.
Thank you.